I've returned. I had a really long space of time where I just was not making makeup videos or videos to camera because I've been ill for 4 weeks. Hate this bit of bullshit. I have no immune system, so it doesn't do me any good. Why do my hands look so much paler, like weirder than my face? I have baby hands. My hands are really small, but I'm double jointed, so like Lelouch hands, like. Hey, let's get down to business to defeat the cis hets. No, we're not gonna go there. Sorry, that was an awful joke. I'll let myself out. So we're gonna, I can't talk properly. We're gonna do a gender video again today, and I'm just gonna have to forgive me. I'm crying a lot. Don't know why. Perhaps it's just the depression. We're gonna do this on surgery before tea. Surgery before testosterone, for people who don't know what tea is, and I'm not talking like I'm gonna have surgery and then I'm gonna have a nice cup of Earl Grey. This is about how non-binary peeps don't have to go through the standard male transition to get what they want. Now, I've always termed non-binary people as the pick and mix gender, and this is because within non-binary, which of course is an umbrella term, there are so many different types of people and how they present, how they associate themselves with labels, how they don't associate themselves with labels. There are so many. So pick and mix gender works well because when it comes to transitioning, one non-binary person's transition will be hella different than mine. Like, you have some non-binary people who just don't transition medically at all, and then you have other non-binary people who, when they transition, they like remove all gender markers on their body just because that's how they need to present, because that's how their gender identity is in their head, so that's how they do it. Anyway, so pick and mix gender works well. Now, for me, I needed top surgery ASAP when I started transitioning. It was the most awful thing about my dysphoria was my chest. It was hellish. I had so many issues with my chest growing up. I needed a new bra. Like, the bra I had was awful. It was dirty, it was old, I kept using it again and again, and my mum took me into like a bra shop and I just burst into tears, and for the life of me at that moment I couldn't say what the hell it is was wrong, apart from I just did not want to be in there picking out a bra. So I've had issues with my chest for a fucking long time, like even before the realization of gender having more than 2 options. So when I went to transition medically, I was like, top surgery comes first. I'm thinking about hormones, but I don't necessarily need them right away. I need my top surgery. I'm in pain from binding. I have got bruises from binding. I'm in, just let me do this bullshit. How can you do that in the UK? Now, I can only give you my private medicine story because I'm private, because I've got health insurance from my family's job, which means they'll pay for private, meaning I didn't have to go on the NHS. First of all, I went to Gendercare. Gendercare is a small clinic in London with a few doctors and professors, and they deal with referrals and diagnosis of gender dysphoria. The first thing I did was I got an appointment with Dr. Lorimer. I'll put his link below. I'll put Gendercare link below. And he does the gender dysphoria diagnosis over, like, it's a long talking session. You're there for like an hour and a half just talking to him, and it goes through everything. I mean, like, your entire life story, asking questions about you, about how you see yourself, what you'd want. Are you aware of this? Are you aware of that? Just making sure that you are able-minded to make these decisions and that you don't have an underlying issue that could be causing these issues as well. He does the gender dysphoria diagnosis, and I got that, and he gave me a diagnosis of a non-binary individual, but placing me on the masculine transgender scale, because they do it from like numbers. So it basically, I was really high up on that, and it's like a marker of you being kind of in the middle identity-wise in terms of masculine to feminine. Anyway, he got me my diagnosis, and the next thing was him saying, giving me recommendations of surgeons, and a recommendation to his colleague, Dr. Seal, who deals with hormones. Dr. Seal has a 1-year waiting list, so I called up, made an appointment, and then decided, excuse me, 1 second while I itch my eyeball. And then I decided which, oh Jesus. What the fuck is in my eye? There's something in my eye. What the heck was that? That was disgusting. I decided on my surgeon. Now, I decided to go for a surgeon called Dr. Andrew Yelland. So he was a surgeon in Brighton, which is kind of close to London in terms of like it's an hour, 2-hour drive from my place. So that was a very good surgeon to choose. And he's known for doing a lot of non-binary surgeries where you haven't had testosterone first before you have your top surgery. Now the issue for this is my camera died. Forgotten where I was. I was talking about Andrew Yelland and my surgery. So I went for him. He's in Brighton. He's a good dude. And he does a lot of non-binary surgeries, and went for my initial assessment. And instead of having to wait like a year, which is like the NHS thing right now, maybe more than a year, he was like, I can do this in 3 months if you want. And I was like, I can't do 3 months because I have to pay for it. It's really expensive. So I got it done in November on the 27th, which was amazing. And we're actually about to come up to like almost a year anniversary of top surgery, and this year's been incredible. So on the day, you go in early in the morning. I mean, like really early in the morning, like 6, 7. Because you're given a slot in the day for what time you're going to have your surgery. I was very lucky. I got the first slot in the day, but a friend had to like wait the entire day, then have surgery, which is kind of nerve-wracking if you're not happy with surgery procedures. Then they just put a needle in your hand. It's a bit disgusting, but they knock you out so quickly. They did a whole count to 10, and it literally takes 10 seconds, not even that, to put you to sleep. And then you're asleep for the entire thing. And when I woke up, I was in the recovery room, not back in my room, and I could like see nurses around me, and I was really like just out of it. They were like, do you need water? And I was like, not even talking, just being like hand signals. I felt a bit nauseous, which morphine can do to you sometimes. So like, do you want something for the nausea? I was like, Rah. And I was like, thank you. And then they wheel you back in your bed to your room, which you have like a private room, which is really nice. So you're not with other people. My parents were there, and the friends came over as well after in the day. After the surgery, you are just so numb in your chest. You don't feel anything. It feels a bit weird, but you don't feel anything. And then they will change your dressings if the blood comes through too much. And they will twice give you some antibiotics into your IV, which I have to admit is like the worst thing about going to the hospital, because with antibiotics in your system, they're always cold, so you can feel like the ice creep up your veins, and it just freaks me out every time. But luckily, you know, I only had to do it twice, and some people have to do it a lot more, so it's, you know, reasonable. After that, the next day, you go home. I'd recommend getting someone to drive you so you don't have to go on public transport, because you're going to be really sensitive and just don't want to pull anything. Like in the first week, you do not want to pull your stitches, because you will then have like bigger scars. For the next few weeks, I just stayed in bed and played Persona 5, because at that point it doesn't hurt, it's just really freaking itchy, because you have to have like a medical binder on to keep everything in place, and that thing does not breathe at all. So it's like sticky and sweaty and gross underneath, and you're not allowed to bathe as well for like a week and a half. Basically, you can't get your bandages wet, so I had to have like my mum wash my hair like over the bath, like just like that, because I needed my hair washed. And then you come back a week or week and a half later, and the surgeon takes the staples out of your nipples, which is lovely. But that's like the first moment you see your chest, and it's a fucking amazing experience. And I'm gonna show you guys some post-surgery photos now, actually. And this is what my chest looks like ATM. So next thing I wanted to briefly mention is I don't know how this is for NHS non-binary patients. I heard a very worrying story from a friend who's non-binary like me and needs chest surgery first. And the NHS doctor that they saw said that they couldn't have top surgery until they like legally changed their name, had their diagnosis done. They're looking at like 3-4 years of stuff happening before they can get top surgery, and that they had to be on testosterone first. And we know this is bullshit, because the private profession will just do it, because it's proven to not be an issue. There used to be concern in the medical community that if you had your surgery before you had testosterone, when you had testosterone, your body shape changes, and that the scarring wouldn't look as correct. It just doesn't really matter, really, depending on what you want. I feel If you need top surgery, you need top surgery first. There shouldn't be an issue there. So in the NHS, you might come across a doctor who's a bit dickish, in my opinion, and say that you have to do all these things first. But then I've also heard like other stories from the NHS saying that they'll just recommend you. I don't know what's going on with the NHS. They seem to be in an absolute muddle for what they're doing. I can recommend doing the private route through Gender Clinic. It's been pretty simple and pretty effective and pretty fast. So if you've got a few grand, I'm gonna say a few grand, quite a few grand to spare, I'd recommend doing it. You get it done in a month, 2 months, maybe 3 months. It's simple. I wish the NHS were better because honestly I'd be on it and not asking my family to pay huge amounts of money for it. But alas, I cannot deal with waiting for 4 years just to have top surgery. It wasn't going to happen. This has been surgery before tea informational video. Not sure if it's that informational, but I hope you enjoyed it nonetheless. I'm not sure where I'm going next in my gender series. I'm thinking I might look at non-binary presentation in the media, talk a bit about that debate. I hope you tune in for that video when it comes along. And if you would like and subscribe to me on my YouTube channel, that is amazing, and that sounded so cringy, but really follow accounts give me little rushes of endorphins in my mind, and with long-term depression endorphins are pretty much, you know, needed. So yeah, hit a like and subscribe. I freaking love you.